I'm Yvonne Dunitz. Welcome to the COVID-19 Community Update. The following is a statement from Sherry Hossman, President and CEO of SolutionHealth. April 15th, 2020. Every health system in the country is facing a similar unprecedented situation. The need to abruptly transform and reconfigure one of the most trusted and essential assets our community has during a deadly pandemic. We are on the front lines of the war against COVID-19, and in order to help contain the virus, create capacity for predicted surge of severely ill patients, and preserve precious personal protective equipment, SolutionHealth stopped all non-essential activities mid-March. While the right thing to do, this cut our revenue in half. At the same time, we invested in rapid preparation for the predicted surge of patients by purchasing ventilators and PPE, cross-training staff for redeployment, and adding more than 100 beds to our acute care settings. As a result of these necessary actions to play our role to defeat this virus, we estimate we will lose more than $24 million per month. While we do not regret doing all that we can to prepare for the predicted surge of patients to be sure that we are ready to, literally, save lives, we now must take action to reduce these unsustainable losses to ensure our viability for the future. We have redeployed hundreds of staff members, and we have rapidly implemented a telemedicine model in both Manchester and Nashua to ensure that we can still care for patients who need care safely and effectively. However, the cessation of all non-urgent care has resulted in some staff not having work to do. Just like the rest of the country, we do not know how long this lack of activity is going to last. As such, we made the difficult decision to move roughly 650 staff to temporary furlough status and implement a 15% salary reduction for our SolutionHealth senior leaders. Furloughed employees will maintain full benefits and will work with them to apply for unemployment benefits, including the enhanced benefits that the federal government has put into effect in response to the current economic crisis. In addition, approximately 750 employees are working reduced hours or have reduced salary due to low activity in their work settings. SolutionHealth has approximately 7,000 employees, so approximately 20% of our workforce has been affected by these difficult changes. We recognize and regret the personal impact this has on our loyal employees. On behalf of our board and system leadership, we are extremely proud of the effort, commitment, and support of all our staff during this challenging time. We stand ready in partnership with other hospitals in Manchester and Nashua for the predicted surge in patients. We are also focused on ensuring that we can rapidly resume all services and care activities to both continue to care for our community as they expect from us, and also to bring our furloughed employees back to work as quickly as possible as the virus subsides. About SolutionHealth. SolutionHealth is a highly coordinated regional healthcare network founded by Elliot Health System and Southern New Hampshire Health. Its purpose is to better serve the healthcare needs and interests of Southern New Hampshire as a region by improving and increasing access, quality, value, and community benefits. As of Monday, April 20th, 2020, there are 2.4 million COVID-19 cases globally, 759,786 in the United States, 1,392 cases in New Hampshire, 131 cases in Nashua, New Hampshire. Globally, 3.8 million individuals have been tested for COVID-19. The Nashua Division of Public Health continues to answer its hotline for residents to call or ask any health-related questions regarding COVID-19. The Nashua COVID-19 hotline is available 7 days a week from 8 a.m. to 9 p.m. If someone calls during off hours, they can leave a message on the voicemail and someone will get back to them the next day. The number to call is 603-589-3456. The Nashua School District continues to prepare bagged lunches and distribute at 10 schools delivered by the City of Nashua Transit System Big Blue buses. Bagged lunches are available for curbside pickup at the main entrances from 11 a.m. to 2 p.m., Mondays, Wednesdays, and Fridays. The list of schools can be found on their website at www.nashua.edu. We recommend, along with the CDC and NHDHHS, to wear cloth face coverings in public settings where social distancing measures are difficult to maintain, including grocery stores and pharmacies. Wearing simple cloth face coverings is an important measure used to slow the spread of the virus by protecting others from your respiratory droplets, especially if you are asymptomatic and do not know you have the virus. Wearing cloth face coverings minimizes the transmission of the virus from you to others and is a voluntary public health measure that is strongly recommended to slow the spread of COVID-19 in our community. Wearing a cloth face covering alone is not enough to protect you from COVID-19. If you do wear a cloth face covering in public, please continue to practice social distancing by staying 6 feet away from others and washing your hands frequently for at least 20 seconds. When removing your cloth face mask, do not touch your eyes, nose, and mouth, and wash your hands immediately after removing. It is important to wash your cloth face covering after each use with warm water and soap. A washing machine will suffice for proper cleaning. Cloth face coverings can include household items, such as bandanas or face wraps, or made at home from common materials at low cost. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders, as recommended by current CDC guidance. Cloth face coverings should not be placed on young children under age 2 years of age, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. When wearing a cloth face covering, they should meet the following criteria: fit snugly but comfortably against the side of the face, secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to shape. Does wearing gloves really protect us from COVID-19? Gloves are typically worn to avoid cross-contamination. For example, Healthcare workers wear gloves when they need to touch a patient or perform a task that requires some type of sterility. It helps to protect both the wearer and the patient from contamination. The healthcare worker immediately removes the gloves after the procedure is performed, throws them away, and then washes their hands before moving on to the next task. During this time of COVID-19, if you decide you're going to wear gloves, you should take into consideration why you need the gloves. Gloves alone are not enough to protect you from COVID-19. If you wear the same set of gloves to perform multiple tasks, you are actually moving germs from the objects you touch with the gloved hands from one object to another. Think about all the things you touch throughout the day, from doors to your steering wheel, from shopping carts to your cell phone, from pens and credit cards to so many other items on a frequent basis. To protect yourself as best as possible, we recommend that if you choose to wear gloves, that you only wear them for completing a single task at a time, that you properly put them on, donning, and remove them, doffing properly after each use, and that you wash your hands for at least 20 seconds before, after, and each time you change your gloves. We want our community to know that if you are not a healthcare worker, it is actually safer to not wear gloves, but instead to wash your hands or use an alcohol-based hand rub if soap and water are not available after going out for essential needs. The City of Nashua officials held a press conference on Friday, April 17th about the Nashua COVID-19 response. Due to the fluid nature of the COVID-19 crisis, Southern New Hampshire Services is no longer seeing clients or visitors in their response resource centers and offices. They are still available to serve their clients via phone. For a full list of SNHS locations and phone numbers, and for further resources, please visit their website at www.snhs.org. The Nashua DPHCS has the opportunity to provide community testing using the following detailed criteria. This will be a drive-through testing site available by appointment only, scheduled through the Nashua DPHCS by calling the Nashua COVID-19 hotline at 603-589-3456. We will have a limited number of tests available, and individuals must be able to drive to the specified location that they will be given if they call to schedule an appointment. If the individual has a healthcare provider, we are asking them to please contact them to discuss testing. If the individual calls the Nashua DPHCS and indicates they are looking to get tested, a staff member will pre-screen each individual. For the purpose of this clinic, we are prioritizing people in the following groups to be tested for COVID-19 if symptomatic. However, not having symptoms should not preclude the person from being considered for testing if they believe they have had exposure to someone with respiratory-like illness. Individuals who do not have primary care providers or for whom providers won't test or who don't have health insurance. Any person who may have had close contact with a large number of people in high-risk settings, such as shelter workers, jail, mission, soup kitchen. Essential workers who deliver or directly support home, community, or institutional care services. Individuals with underlying chronic health conditions, which puts them at increased risks of complications from COVID-19. The Nashua DPHCS will reach out to Greater Nashua Mental Health, Soup Kitchen, Bridges, and other Greater Nashua shelter partners to have their clients and staff know they can get tested by appointment only. Again, staff and clients will need to call the Nashua COVID hotline at 603-589-3456 to schedule an appointment. They should not just show up at the testing site. Nashua DPHCS public health nurses will be testing with standing orders to test without a physician's recommendation. Primary care providers should not send individuals to the test site unless they absolutely do not have the ability to test. If you have further questions, please call the Nashua COVID-19 hotline at 603-589-3456. Temporary assistance for needy families, the Office of Refugee Resettlement, within the Administration for Children and Families, announces the availability of funding for the Wilson Fish Temporary Assistance for Needy Families Coordination Program. This new initiative funds the development and implementation of innovative approaches throughout a state to facilitate access by refugee families with children under the age of 18, or TANF eligible refugees, to relevant, customized, and culturally and linguistically appropriate integrated services and or resources that harness refugees' specific strengths and address the challenges they face post-resettlement. Examples of such services and resources include, but are not limited to, employment training, English language instruction, enhanced case management, other social services, the use of community liaisons and navigators, and the development of information in languages commonly spoken within resettled refugee communities. Projects proposed under the WFTC program will identify TANF and ORR funded programming currently serving TANF eligible refugees to develop and provide in-person and remote services and or resources that will enhance or complement that programming and address unmet needs of refugees. The WFTC program requires grantees coordination with the subdivision of the state agency tasked with the operation of the state's TANF program, or State TANF Office, and the Office of the State Refugee Coordinator, or the individual responsible for the statewide or regional coordination of the refugee settlement program, as applicable, as well as the development of fostering of partnerships with other stakeholders. New Hampshire awarded SAMHSA grant for crisis intervention services during COVID-19. The New Hampshire Department of Health and Human Services announces that the Substance Abuse and Mental Health Services Administration, SAMHSA, has awarded New Hampshire a $2 million grant to assist individuals impacted by mental health and substance use disorders during the COVID-19 pandemic. DHHS will use this emergency funding to establish New Hampshire Rapid Response, a comprehensive system that will provide crisis intervention services, mental health and substance use disorder, treatment and other related recovery supports for youth and adults impacted by COVID-19. New Hampshire Rapid Response will address the needs of uninsured or underinsured individuals with serious mental illness, serious emotional disturbance, or SUD, through the state's existing community mental health system, which includes 10 private, nonprofit community mental health centers. These community mental health centers provide comprehensive, evidence-based mental health and rehabilitation services to people with SMI and SED in regions across the state. The program will also provide crisis services for other individuals in need of behavioral health supports, including healthcare personnel. For more information about the emergency grant, please visit the New Hampshire DHHS website. May we all be safe, may we all be healthy, may we all be happy, and may we all live at ease.